Do you still have that pain?
No, that pain is gone.
Gone since yesterday's surgery.
Yes.
Great, huh?
Yes.
Feels good, doesn't it?
That does feel good, let me tell you. To be pain-free.
And good morning, I'm Dr. Deuk. I'm here with one of my patients who happens to be a retired nurse, and we just did the Deuk laser disc repair on her lower back just yesterday, less than 24 hours ago. And here you are back in the office. How do you feel?
I feel great. I couldn't believe that I could get up this morning and not have that pain. You know, I have been with pain for a long time, but acute pain for the last month and a half, and in bed for 2 weeks, not being able to just do anything. So I was thrilled to be referred here and to come to see you and to have this relief, for sure.
You had back pain and left leg pain, is that correct?
Correct. Hip into my knee and down into my foot.
Do you still have that pain?
No, that pain is gone.
Gone since yesterday's surgery.
Yes.
Great, huh?
Yes.
Feels good, doesn't it?
It does feel good, let me tell you. To be pain-free of that.
Well, things look good. We did everything through a 7mm incision, and we fixed 2 discs and unpinched her nerve. Were you offered other types of surgery by other surgeons, or did you just come straight here?
I was offered what they call an anterior-posterior approach last May. And because my husband's disability and that I take care of, I was like, I can't be out of commission for that long. So I came back to Florida and went to my general practitioner, and I said, I have got to do something when I got this acute pain. And he said, let's try someplace else. Let's go to Deuk Spine.
Yeah, an anterior and posterior approach surgery is major surgery with a high risk of complications, even death. And you avoided all that, and you had an outpatient surgery with a tiny little incision instead. So what are you gonna do now that you've had your surgery and you're feeling better?
Well, I'm gonna follow all the rules, first of all.
Of course.
But I just want to get back to my life again, being able to
be a
walk.
nurse, right? And work in the operating
room. He's
And
trying to recruit me.
I'm trying to recruit her. I've been trying ever since she got out of surgery. You know, even when she had the truth serum on board, right?
Yes.
How long were you a nurse for?
Right, dear, tell you, since 1978.
Wow, in 1978 you got your nursing degree and license, and you've been practicing. I know you've had experience in the operating room.
Yes.
So you've probably seen a few spine surgeries in your time.
Yes, I did.
And how does the Deuk laser disc repair compare to those spine surgeries?
It doesn't compare at all. I mean, you are on top of the list. You know, 5 stars. If I could give you 6 to 10 stars, I would.
That means a lot to me, especially coming from someone like you. So what do you want to tell your fans out there that are watching your video? Anything you want to tell
Don't hesitate. Don't suffer with that pain. Please, you know, come here. I've already told my general practitioner, please, I wish you would have sent me there a year ago when I was having issues. So don't hesitate.